Well, good afternoon, everyone. Welcome to GCHU, or the Global Centre on Healthcare and Urbanisation. This is our Week 8 seminar, our public seminar. Today it is on artificial intelligence in urban health, and our guest speakers will be answering the question, is AI a solution for healthy cities? And over the last few years, we've been experiencing a health crisis or a health global pandemic, as well as the issue around global warming and our climate crisis. So here we're and also in September of last year, the UK government published a national AI strategy. And that strategy had 3 pillars. And in the second pillar, they were looking at what areas are of focus when we think about AI in the UK. And 2 of those areas were around climate and Vision Zero. And the third element was around health. So this is a timely discussion around how we can use technology, or is technology the solution for these big global issues that we face today. So I'm delighted to introduce our 3 fantastic guest speakers from across the UK as well as in Europe. So we have Professor Gina Neff from Cambridge, as well as a professor here in Oxford. We have Dr. Allison Powell, who's based down in London, and we have Dr. Ezra Sul from Switzerland. So thank you for all coming. And so this afternoon we'll start with Professor Gina Neff.
Thank you. And I just realized I've done that wonderful thing where I don't have the clicker. We're out of practice doing in-person live events. And we'll see if these come up. Take a moment for magic. This is the 2022 version of, am I on mute? Okay, so I'm Gina Neff. I run a new research center at Cambridge called the Minderoo Center for Technology and Democracy. And I want to throw this question out and do some framing around this question. Is AI the solution for healthy cities? This question goes to some of the core themes that we're taking in our new center. And I want to use those themes to have a think with you on how we might approach this question. So of course, as Georgia mentioned, we're looking to multiple kinds of solutions to talk about public health going forward in the post, whatever this is, the new normal, the building back better. My kind of provocation tonight is, okay, are we healthy for whom? Healthy where, healthy how, and to what ends? So one of the questions really is that we need to be considering the costs of the data that it takes to run large-scale AI systems to both our society and our planet. This is the driving mission of the work that we're doing at the Minderoo Center. So what do we mean specifically about that? Well, if we look at how new kinds of AI systems and the data that they require create new infrastructures in cities, in governments, in public life, then we get to see some of the risks and some of the challenges that are at stake. So what might be some of those risks? The idea that once data are collected, it becomes very hard for people to understand how to opt out. It becomes very hard for people to understand what kinds of questions might not want to be posed. To frame it back to the National AI Strategy, the National AI Strategy doesn't start with what's a great path forward for the UK. It's how are we going to use all of this great AI in the future? So rather than starting with the questions of what do societies need to be healthy, what do cities need to be healthy, we're starting with the questions of, okay, so we've got this cool tool, and critics like some of those up on the panels, the critics of technology would say, okay, wait a second, maybe we need to be asking those other questions first. Who are we doing this, and what are the costs? The first cost is that unlike kind of the image that there's just loads of data out there waiting to be analyzed, making a data set, making an AI system is an enormous amount of work. And right now, much of that labor is hidden, and much of that labor is parsed off in corners and pockets that we don't really consider. I would argue these have enormous implications for how we think about healthcare. So, for example, several years ago, I'm sitting in all places in China with an American engineer who very provocatively says, everything that can be sensed should be. So everything we can put a sensor on, we should gather that data and then we'll find out the questions. And the sensors he was talking about were environmental sensors on street architecture, so on light posts that can detect whether or not a cough is bronchitis. I mean, after all, what could be so dangerous in 2015 of talking about sensors that can detect someone coughing when you're sitting in China? And someone detects someone coughing without their permission, without gathering, without noticing. Like, why would we want that data set? That data set could be, now we see in a COVID times, actually incredibly damaging and incredibly harmful and incredibly difficult for people. So the idea of this idea that, well, we have the technological capacity, let's just find the use for it, often misses the human form factors that create the possibilities for risk and create the possibilities for ethics. And they certainly overlook the work and labor involved to make those data. My next point is that data really change once we gather, once we build an AI system, once we gather these data, it really becomes shaped in ways that are shaped by social and political decisions. And this is a question that many data scientists, many engineers of AI systems don't want to hear, because our kind of Western rational ethos is, if it's about data, it must be rational, it must be objective. And yet, because we're building systems that have moral, ethical, normative choices built into them, political choices built into them, those questions often don't get surfaced. So what we have is masquerading as an objective system that's had hundreds of subjective decisions and political decisions and minutia decisions, small decisions that end up shaping the contours of that data. Third, and for me, I think one of the more surprising ones is data's cost to the environment. So we've been sold a bill of goods that says our data infrastructure is costless. The paperless office is costless. The Zoom office has no cost. It's cheaper than commuting. And yet, if Google, arguably one of the largest AI companies in the world, if Google were a country, it would be 9th in the world in electricity consumption. Now think about that. We have one company that is the 9th largest energy consumer in the world. We can no longer afford to simply say we can expand our compute power without recognition to the environmental costs. And these are just the environmental costs of the electricity. There's also the environmental costs of building the physical and software infrastructure that's needed for these systems. There's also the costs in undersea cable networks that have huge impact on marine life and marine communities. And so we need to be incredibly thoughtful about what kinds of systems are we building and how are they providing value and benefit. So this is the kind of work that we're doing at the Minderoo Center for Technology and Democracy. We have 4 key themes. One is about public engagement and public understanding around these questions of technology. What do we as societies want and how do we articulate that? One is about this question of work and what the future of work will look like. One is on how these data are changing who and how we trust one another in society. And the fourth is this question of the impact of technology on our environment, kind of reimagining what those costs and benefits and opportunities are. So I would just, in sum, before I turn over to Ezra, these questions that we have of, healthy for whom, healthy where, and healthy how. Those are the questions I think we need to be asking about before we're building new AI tools to help cities be healthy. Thank you.
Okay, hello everyone. So my name is Esther. And first of all, thank you very much for having me today. And I thought I'll start with a bit of my background because I think that influences my perspective on the questions today. So I am an engineer and my PhD was in transport planning. And then for my postdoctoral fellowship, I started working with the School of Public Health at Imperial College London. And that's where I actually started working with people working in health research. And I have a specific interest in urban inequalities. So we already know that there are substantial inequalities in our cities today. And we also generally agree that we should work to address them and reduce them. So we know that there are inequalities in things like income, housing, education. And it's part of local and national policy agendas to try to address them. But to be able to address them, we need to first be able to quantify and measure inequalities in our cities. And that is actually a big challenge. Even in data-rich countries, in high-income cities, we see that we're relying mostly on census data that is conducted maybe every 5 to 10 years, and it is very expensive to do, so we cannot really repeat them more frequently. We also have data from surveys that are like smaller in sample size, so you often miss out on the resolution that you might need. So I think that is where AI tools and the data that we are collecting today might actually offer a lot of opportunities. So what type of data I'm talking about? So like data that is being collected by a mobile phone, social media data that is being generated as a byproduct, and street images, satellite images. For example, in our work, we saw that we were able to basically use street images only with deep learning models. And we were able to find out that actually multiple deprivation measures can be predicted by using street images only. And this idea is not new. So Charles Booth, who was an English social researcher, had the same idea. So he wanted to basically use the visual information we have. And they actually came up with these very detailed maps of poverty for all of London. So they went through each street in person. But what is new today is it took them 20 years to complete it. But today we can actually do this in a matter of days. And there were two developments that made this possible. One is we actually have access to data. So companies like Google, Mapillary are collecting these street images. So we actually have access to them. And second, we have the methods in deep learning and machine learning that can actually help us to analyze these images and make sense of them. So these data sets and methods are out there, but of course they come with their own problems. So first of all, they're not being collected for urban measurements. So they're messy and often biased. And it is private companies who actually generate and store them. So access is often an issue. And we have a lot of open questions around what is it that we're collecting, as you were saying, privacy issues, accountability, regulations around these things, we don't know yet. And even from a methods perspective, even though there were a lot of developments in the past, we still need to think a bit more about how do we actually combine all these data sets that we have together with traditional data sets to make better measurements, to actually try to understand change, because what we need is actually, so if we have like data from one point in time, that is actually not sufficient, because we actually want to understand how things change over time in our cities, especially because we want to understand if our interventions or policies are making the change that we want to be making. So all of these things also require some methodological developments. So on a positive note, I actually wanted to end with that, I guess, because I think there are a lot of opportunities in AI tools and the methods and the data that we're collecting. But we should really be asking ourselves, first of all, what is it that we want to be collecting data on? What do we care about for healthy cities? And how do we decide on what resources to invest in to make these measurements from our cities? And if you look at clinical care, you see that we actually have great tools to make precise measurements from the individual. For example, you have the CT scans, the MRI scans, and those were really critical in advancing how we do diagnosis, treatment. And if you compare that in how we make measurements in our cities, you see that we actually have a lot to improve on. And I think this is where like AI and the data technologies have the potential. And then and of course, like having measurement data on its own will not be sufficient, because the complex decision-making processes that are needed for us to ensure healthy cities for all will require much more intelligent systems and actual human intelligence to actually make the decisions. But I think it's a critical starting point. And then maybe we can think about methods potentially to help us make these decisions, to try to decide between interventions or policies. And I hope to hear your opinions about that as well in the discussion. So thank you.
Thank you so much. It's really a privilege to be here, especially with such esteemed colleagues. My name is Allison Powell. I'm an associate professor in the Department of Media and Communications at the London School of Economics. And I've been working on questions around technology and urban experience for a long period of time. And I just published a book called Undoing Optimization, where I look at the kind of history of the smart city and the idea of the pursuit of optimization, which of course is a kind of computational frame for improving the function of particular systems within various bounds, right? So within a maximum or minimum range of tolerance. And one of the things that I was interested in when I was writing that book is about what kinds of experience is part of urban life and part of the kind of value of urban experience that is not easily amenable to being optimized in this particular way. And I wanted to start with that when discussing this question of AI and health, because I think it's quite important to think about what does one consider to be health, and what does one consider to be, if we take a sort of more philosophical perspective, that notion of flourishing. What is a good experience in a city? And a good experience may not only be the kind of determinants of health that are part of social policy, but it might be other factors and features that make community life or kind of an engaged population active, let's say. And so one of the things I write about in the book are the kinds of knowledge, intelligence, and experience that appear sort of counter to the data and processes that are being optimized, the sorts of things that are considered maybe like less easy to streamline, but are perhaps more valuable as exercises of citizenship, even if they're not sort of quote unquote good citizenship. So I want to use that to sort of frame my remarks here, which are actually much more about how you might want to capture the other things in human experience or in urban experience or in urban health that are not so easily put into the kinds of models that Ezra is describing. And I think I'm going to be echoing some of Gina's concerns, but I want to focus on three specific aspects. I want to focus on autonomy, trust, and value. And I'm going to do this by talking a little bit about how health data has so far been processed, not at an urban level, but across the UK. So in the midst of the pandemic, I got news that the US company Palantir was becoming responsible for putting in place an AI system to optimize and manage the distribution of health resources across the UK. And this meant using an AI system trained on US healthcare providers to do things like determine how to route ambulances, where to deploy NHS staff, and where to move PPE. And the fact that this happened in the middle of the pandemic without a kind of oversight from a legal, regulatory, or parliamentary place was one potentially egregious problem. But the other problem is a problem that's common to the use of lots of AI systems, which is the problem of bias within this system. So we have a US company that's trained its models on a privatized, scarcity-based healthcare system that is now applying them in a fully public, free at the point of use healthcare system. So what sorts of assumptions are Palantir's AI models for the distribution of health resources actually making? They are likely to be making decisions that are based on biases that we know about, like biases of inclusion and biases of exclusion. So for marginalized populations, biases of exclusion are when you don't appear in the database. I suspect that many marginalized populations in the United States do not appear in Palantir's healthcare management models because we know that those people are less likely to get access to healthcare in the United States. When you start applying those to the UK, whose resources suddenly disappear? We also then have biases of inclusion, which are of course the reproduced social biases that we have in society that are then programmed into things like AI decision systems. These are likely to appear as well in Palantir's system. But the third thing is that the value of all of the data that is publicly collected here in the UK on our entire population who's accessing healthcare systems is now going into a model that the UK health system no longer has control over. So this has become a public resource that is suddenly transformed into a private resource. So this raises some massive ethical issues that are really about the kinds of decisions made when we put in place these systems for improving urban health. And we did not have the recourse either to kind of regulatory decisions around Palantir's inclusion in this, nor did we win the vote in the House of Commons or in the House of Lords that requested the creation of what's called a sovereign health fund, similar to a sovereign wealth fund, which governments like Norway have based on the value of the resources extracted from North Sea oil beds. We do not have, as we could, a sovereign health fund, which is based around the value, the aggregate value of the data that is used to describe the healthcare experiences of the entire population of the UK, because this was not something that was approved, but this is possible. So here's where I want to talk about other opportunities to think about autonomy, trust, and value in relation to these AI decision-making systems for determining health outcomes and increasing population health. I want to tie back to my point about what is outside of what we might think of as the most efficient or useful data. And I'm going to do that by describing a project that I've started to become involved in, which is the creation of what is called a neighborhood ethics committee. And a neighborhood ethics committee is a group of people who come together to decide the terms of reference for the use of their own data, who become an ethics committee that governs the kind of value that might be generated by the data that they produce. There are neighborhood or community ethics committees that have started in several different cities, including in Glasgow and in Birmingham. One of the people that I collaborate with, who's from the research consultancy Radius, has been working on neighborhood ethics committees for quite some time. What I find really interesting about the idea of a neighborhood ethics committee is that it addresses this idea that in fact, it is not the public health system that truly creates the determinants of community health. It is in fact the civic tissue, the connective tissue, the things that are not always optimized for, that is actually the determinant of health. So I live in Walworth in South London, and in East Walworth, which is part of my neighborhood, there are 83%, we're in the sort of lowest quintile of the country for healthcare outcomes. It is one of the most deprived borough communities in the country. And we are trying to set up a neighborhood ethics committee because we think that it might be actually really important for the health of the community for there to be more autonomy over how community data is used. So we're piloting experiments where we think about how to develop data-based products and services within the community that can model ways for the community to own, govern, and value its own data. And there's really good evidence that increasing the relationships of trust in a community like East Walworth actually increases the positive health outcomes. So it's being in a place where people can be trustworthy that is part of an overall kind of experience of population health, and not only the health outcomes that are that are able to be transformed into data. So what I'm very curious to see as this project unfolds is how the idea of increasing the capacity for a community to autonomously value and govern its own data and its own information might kind of intervene in this idea of making everything super efficient. Because the fear that I have about making everything super efficient is that it opens the door to these kinds of problems, like the problem we saw with Palantir. Palantir has a very powerful AI, but there is no way for anybody to judge how trustworthy it is. There's no way for anybody to take themselves out of it. And most importantly, there is no way for anyone to determine what the value of the data being included in that process might be. So I think I'll finish there. Thank you.
Excellent. Thank you to our speakers for some very insightful pointers looking at the benefits of AI that we may have, as well as the challenges and governance and issues around all of that. So now I'd like to open it up to the floor. This is your opportunity to ask our speakers any questions that you may have. And Robert will be around with the mic. So. There's a hand here. Howard.
Thanks very much indeed. That was really interesting three pictures about AI. I think Gina mentioned Google, and Alison's mentioned the company running the database. I think we're all aware of the dependence of civic society on the internet run by private companies. Is it a case then that with the advance of AI, that again will be another issue, that it's in the hands of private corporations for delivering public services in some part?
That's a great question. There are wonderful examples of how cities are doing the right thing when it comes to data. So for example, the city of Seattle has taken a radically open approach to public data and essentially opened their API, opened the ability for people to build and develop on urban data. Now that ostensibly opens up problems or questions of co-optation. However, what they've done on a local level is also invest in the capacity for communities to start querying and asking and designing and creating things and services and products that they need. So yes, I think the real risks are there. And the real risks are there in large part because this isn't a zero-sum game. There are very large companies, the largest companies human history has ever known, the most financially powerful companies that human history has ever known, that are able to command the resources, the talent, and most importantly, the data needed to build robust models. Now, not all AI is, massive, enormous models, right? I mean, some we're talking about machine learning and unsupervised machine learning on data sets that can come from, many places, right? But in terms of building robust data sets on country level data, there's very few levels of actors who can do that. And it's partly why I think the question of this resource that we have in the UK of great healthcare data is something that's such a vexing problem, because it is a resource and it's a resource that can be used for good. And yet it needs those political and social decisions and choices and cultures and values that build it to benefit people, not to harm them. I will leave with one philosophical question before I turn it to my panelists. And this came out of, I have just launched last week, 2 weeks ago, a new book called Human-Centered Data Science, where we bring together techniques from the social sciences into data science to help people understand what it might be to do data science from a more human-centered design perspective, for example. How do you put people first in data science projects? And the starting point for data science is so fundamentally different in terms of what data do I have access to and what will the data be able to do, as opposed to the starting point from people designing products and services from a human-centered perspective. What's the problem? Who are we designing for? And so I don't think it's hopeless. I actually think we can do better, but we can't simply rely on ethics training and training of individuals to be good at this, because we are dealing with some of the most powerful organizations that human history has ever seen.
I also think this is a great question, and I think this is one of the biggest problems I think we have, because I think both the data sets, that is, like, I guess the biggest data sets, are owned by these private companies. And on top of it, I think the algorithms that are trained by these data sets are again owned by these companies, even though we're the ones who are generating the data, and that data sets are actually created by individuals, or like they're taken from our streets. Yet the ownership or the access is being controlled by these private companies. And I think we should do better to think about owning these data sets and thinking about like ownership, different ownership models and access models when we think about not just the data sets, but also these trained algorithms that we were talking about, so that we can actually hold these companies accountable or make our own decisions about the data that we are actually generating collectively.
I mean, I can just say what they said, but I wanted to add one very small thing, which is actually that the models exist. And so the responsibility is not to come up with the new ownership models. It is to advocate stringently for them in different settings, right? So there are models of data trusts, like collaboratories. The Ada Lovelace Institute put out a very nice report recently on participatory data governance, using many different examples of models that one could use to create different data governance structures. So something like a sovereign health fund is like one kind of governance structure, like we will let you use this data, we will basically rent it out, but whatever value you generate has to go back into this fund that we then reinvest as a country into different kinds of projects. That's similar to a data trust model, which Alphabet, the parent company of Google, experimented with in their Sidewalk Toronto project. And people were generally supportive of the data trust. However, they were unsupportive of the fact that the governance of the data trust that applied to Sidewalk was not going to have anybody from Toronto who would be able to hold the trust's actions accountable. So the project effectively collapsed because of a problem with the governance of the data and the governance of and definition of value of that data. So there is actually like there's a lot of work to be done, but not conceptual work, just actual work in putting this stuff into practice. But thank you very much for that great question. Yes.
So I think you all talked about some of the opt-out and exclusion, inclusion sort of concepts. And so my question was, I'd like your thoughts on what does that do to the validity of the models and the data sets and the outputs of these AI systems? And does that risk potentially exacerbating existing inequalities for those who can essentially are able to opt in and sort of be represented within those data sets?
Thank you for that question. I think that's another great question. And one thing that I can, I guess, think of from my own research is, so as I said, we were working on trying to use images to make measurements in cities where we don't have data, or at time points that we actually don't have data. And we were trying to see if there are biases when we're trying to measure poor places versus rich places. And we find out, for example, that it's actually much harder to, these deep learning models that we trained made more errors when trying to measure poverty as opposed to measuring well-off places, which is a real problem, right? Like, because if you're actually most likely interested in identifying deprived areas, and then your models are actually making the most error there, but maybe if you're coming up with an aggregate error metric, then you might actually miss out on that. And then how do you actually deal with that if you rely on these systems for measurement? It becomes a problem. But again, coming from my background, I guess, like, I think about these issues more from a data-driven perspective to somehow try to understand where these models can go wrong and to know more about them and then make the decisions based on that knowledge, I guess.
I'm going to throw one of the questions back at you in a way, which is, are healthcare problems data problems? Or maybe better, what healthcare problems are data problems? So when we're talking about deprivation, at least in the United States, where I have quite a bit of experience, more experience doing research in the healthcare system, we actually know a lot of what needs to be done to help marginalized people live healthier lives. It's not about collecting more data or better data. It's about designing interventions and having the political will to carry those through. I would say globally, we could say the same thing about the COVID-19 pandemic. More and better data. I mean, this has been a pandemic that's probably, it is the data-driven pandemic. And yet some countries have had terrible outcomes despite capacities in world-leading genetics research to be able to track the evolution of a virus, despite world-leading epidemiology, despite world-leading research, despite world-leading global public health monitoring that has happened. We've seen terrible outcomes. The United States is about to mark its millionth death. That is inexcusable. And it's not a data problem. It's something else going on. So when we talk, for me, the fear is that when we're building large-scale models to deal with healthcare problems, are the benefits of those models worth the costs of the potential risks of exclusion? And then how can we work to help to design the data systems that get it right, that do it better? So there's some things that we talk about in the human-centered design, human-centered data science book. One is this bias of the streetlight effect, and the story goes, someone loses their keys, and they look across the street to find their keys, and someone says, "Well, I'll help you look." And they say, "Well, I didn't drop them on this side of the street. I dropped them on the other side of the street." "Well, why are you on this side of the street looking for your keys?" It's like, well, the light is better here. And so many of our data problems is this is where we have access to the data. This is the kind of data. We have Google, we have a database of Google Street Maps that we can search. We have certain training data and common training sets that are available and accessible. And those become our starting places rather than looking where the problem is, rather than looking, we look under the street line. And the second thing that we can watch for is to make sure that we have teams building models that have a breadth of experience in the world. And I don't just mean diversity in who a data scientist is, but in the kinds of representation of the skill sets and the knowledge and the contextual knowledge about what is going on. Do you have a communities expert sitting with you as you're designing and building these systems? Is there someone helping to kind of create the models that understands what's at play, what's at stake, and what these things might do? And I've got a whole list of like those problems when that goes awry, but I'll save that for another.
Any other questions from the floor? Yeah, we'll do down the back and then up the front. Oh, sorry, Robert's there.
It's going to turn into a genuine question, not one of these points described as a question. But in order to make it more obvious that I'm supportive, I'd like to start with a minor point, which is that you're using AI as a sort of, as a catch-all term. You don't mean artificial intelligence per se, you mean everything that comes along with it. Large-scale data acquisition, sensor, data science, but also the whole business of ownership in this space and control of technology, control of data, and control of our understanding of data. And so, and what, because you're talking about the environmental impact, of course, most of what Google are using is probably not being used for AI, per se. It's streaming endless bloody videos and everything else. So it's you know, it's part of, there's a holistic approach that's required if we're going to, you know, improve things, and I totally applaud that. What I was going to come down to was just the level at which people work together to try and tackle these problems, and the idea of community or local ethics groups. At one extreme, and well, I was just Palantir's white paper, which have you seen that? You may have.
It depends. I'm not sure exactly what you're talking about, but go on.
Palantir, a lovely example of a company that you may not want to work with. I think, yeah, that's fine. I'll put any bridges in. I think they're symptomatic of a problem in terms of policy made in government, in that the decisions are being made by people who don't really understand AI or data, what it's capable of, and this is a problem in terms of setting policies. Anyway, Palantir have a white paper out at the moment in which they talk a lot about giving individual data controllers, NHS organisations control. They can make the decision about how the data is used. But that's a lovely example of a complete illusion because they're not in a position really to assess risk. And what's more, if they're all separated, they're easily picked off. And I have personal experience of this when we did a big data collection, and a large technology firm came to us and said, we'd like that data. And we said, no, well, we promised the patients, they consented that this data would stay in the NHS. And European liaison for this technology company said, look, we know who your patients are. We can just reach out to them. And for $500 each, they'll hand over the data. So why don't you just shortcut this? And it's that she wasn't wrong. If they had gone to each of the patients and said, company beginning with G, what's 500 quid on your record? A lot of them probably would have said yes. What worries me about the fragmentation to local ethics groups, or to, how do you avoid the problem that then you're too easily picked off by somebody who's just, I mean, if it's a hospital, Palantir's approach where you can choose whether to provide it, you can imagine, you know, if you're, you know, Liverpool and you're not handing over data, it's very easy. You're not playing, everybody else is handing over the data. What's the critical, what's the nice size for legitimate, you know, I'm thinking probably bigger than a street. How local does your ethics get?
That's a really fascinating question. And I think it's a really fascinating question because it raises a deeper issue, which is about scale. And I think that, so my keywords were trust, autonomy, and value. And I think your question is about how, like, what is value and how is value related to scale? So I had two scales in my presentation. I had the country level scale, and then I had the 40,000 people in East Walworth scale. And there's a massive gap between those scales. And what's possible at a country level in terms of like the sort of conception of value is totally different than what is the conception of value for 40,000 people in East Walworth, which by the way is like a collection of like council estates built in every, you know, decade from the 1920s to the 2020s. So scale, so value is very, very different. So you cannot have an answer that is like the perfect scale is here, because the value is different at the different scales. At the country level, we're not only thinking about how my medical record might be valuable for $500 for myself, we're thinking about what Alina Buicks and Barbara Prainsack talked about when they wrote about biobanks, which is this kind of like solidarity of like recognizing that somebody else might need something that is related to what you contributed, but it's not exactly what you contributed. It is the future potential value of your medical record taken along with everybody else's medical records, in the same way that we think about the stewardship of our environment as not being about the value of me smelling a daffodil in the university parks today on a walk, but about the overall value of a functioning ecosystem over time. So that is a sort of value that's connected to that scale. The value that's connected to the scale of the 40,000 people in East Walworth is, can I trust the guy who lives upstairs? So how does us agreeing together about how our data might be valuable as a whole community do for my relationship with the guy upstairs? If I trust that guy better, then maybe he'll take in my mail, and then I won't be worried about my packages getting stolen. And if I'm not worried about my packages getting stolen, then I won't have to run home from trying to do the pickup of the thing at the pharmacy and then my kid. And so these are the determinants of health that are valuable at the scale of 40,000 people in East Walworth. And they are not about the same kinds of solidarity. They are about different kinds of solidarity. They are about acts of solidarity and trusting connections between people. And that value is again, like greater than £500 for your medical record, but actually totally different than that in a way that, you know, that's not comparable really with the value of the whole country. What a great question, thank you.
Well, we'll have to leave it there, but to close, I'd just like to pose a yes/no question. So although we've discussed all the complexities around data, around AI, and how they contribute to a healthy city, overall, do we believe that AI can be a solution for a healthy city, or are we on the no side of the complexities and the issues that we face around data and how we use AI? I'll say yes, no.
Maybe it's not an option. I will say, is it a solution? Absolutely. And it's a solution worth fighting for and getting right.
I'm also going to say that maybe reducing to AI itself as a solution is the wrong formulation. So a solution includes AI rather than AI is a solution.
Okay. And I would also say, I guess it's not a solution on its own, but I think it opens up opportunities for potential solutions.
Well, thank you very much to our speakers. Just to say this, this public seminar also coincides with Bletchley Park Week, which is a really important week here in Kellogg College. So we have a number of events going on this week, so you can go online to the Kellogg website to see what else is happening. We have a keynote speaker tomorrow evening who is a Turing Fellow, and we have some schools coming here to do some work with people from Bletchley Park. So do get involved in that if you're around Oxford for the next few days, as well as our next public seminar will be next term, week 1. And that will be with chaired by Lord Dast, and be looking at urban planning and urban design. So do stay involved and continue to come along to our seminars. So thank you all for coming, and a big thank you to our speakers.